What if we told you that a particular community is facing a disproportionate impact of a severe health issue? Yes, we are talking about HIV in Black communities. It might be hard to fathom, but the reality is that a significant number of African Americans are affected by HIV. The disparity is striking when compared to other racial and ethnic groups. In South Carolina, for example, African Americans account for 67% of the total number of people living with diagnosed HIV. This is despite representing only 26% of the state's population. This issue is so pressing that a day is dedicated to raising awareness about it. Every year on February 7th, we observe National Black HIV/AIDS Awareness Day. The day is about more than just statistics and figures. It's about combating stigma, promoting empowerment, and addressing systemic inequalities that contribute to higher infection rates among Black populations. This year's theme is Engage, Educate, Empower, Uniting to End HIV/AIDS in Black Communities. It emphasizes the importance of regular HIV testing, access to quality healthcare, and comprehensive education. But the question is, why does this disparity exist and how can we work together to end it? To understand the issue, we first need to unravel the reasons behind this disparity. So, let's start with systemic inequalities. These can be a multitude of things, from economic disadvantages to societal biases. For instance, a person from a lower socioeconomic background may not have the resources to access quality healthcare, let alone regular HIV testing. This in turn increases the risk of undiagnosed and untreated HIV infections. At the same time, societal biases can create circumstances where individuals are less likely to seek medical attention. Stigma, for example, is a powerful deterrent. It can make people feel ashamed or fearful of seeking help, leading to late diagnosis and treatment. Stigma can also lead to discrimination, further marginalizing individuals and making it even harder for them to access the healthcare they need. And speaking of healthcare, let's talk about access to quality healthcare, or rather, the lack thereof. Many healthcare facilities may be physically inaccessible to people living in remote or impoverished areas. But even when they are accessible, there can be other barriers like high costs, lack of insurance, or even language barriers. All these factors, systemic inequalities, stigma, lack of access to quality healthcare, they don't exist in isolation. They interact, they intersect, and they amplify each other. It's like a domino effect. The lack of resources leads to an inability to access healthcare, which leads to undiagnosed infections, which then leads to higher infection rates. And the cycle continues. But here's the thing. These issues are not unique to HIV. They are common threads that run through many health disparities. And while they are indeed systemic and deeply rooted, they are not unchangeable. Clearly, the problem is complex and multifaceted, but it's not insurmountable. Efforts are being made nationwide to combat this issue head-on. Consider the HPTN 096 study, for instance. This research project is not just about collecting data and filling up the files. It's about real human lives. The lives of Black cisgender and transgender men who are disproportionately affected by HIV, especially in the southern United States. This study is not only examining the factors that limit access to HIV prevention and care, but also developing interventions to tackle these barriers. Picture a giant, invisible hand reaching out to those in need, offering them the tools and resources to fight against this relentless virus. Then there's the CFAR Diversity, Equity, and Inclusion Pathway Initiative. This isn't your average run-of-the-mill program, it's a beacon of hope in the science and medicine fields. It's a call to arms to increase the presence of underrepresented minorities in these critical areas. Think of it as a stepping stone, a bridge that connects the marginalized to opportunities, to a future where they can be the change makers, the solution providers. It's about leveling the playing field, about ensuring that everyone, regardless of their racial or ethnic background, gets a fair shot at shaping the world of healthcare. These programs, along with many others, are like soldiers on a battlefield, fighting the good fight against HIV. They're part of a broader, nationwide effort to reduce the HIV burden among Black communities. They're about empowerment, about giving those affected by the virus a fighting chance. But let's not sugarcoat it. The road to victory is long and arduous. There are hurdles to overcome, challenges to face. And while these initiatives are making strides, there's still a lot of ground to cover, a lot of battles to be won. These initiatives are steps in the right direction, but there is still a lot of ground to cover. The fight against HIV in Black communities is a fight for all of us. It beckons us to lean into the power of unity, to harness the strength of community engagement, It's through our collective efforts that we can dismantle the barriers of stigma and misinformation. We can replace them with education and empowerment, arming ourselves and others with the knowledge and tools to prevent HIV/AIDS. The path to ending HIV/AIDS in Black communities is paved with community-wide involvement. Each of us has a role to play, whether it's advocating for regular testing, supporting local initiatives, or simply engaging in open conversations about HIV/AIDS. The more we talk about it, the less daunting it becomes. Education is our sharpest weapon in this fight. It's what empowers us to make informed decisions about our health, to understand the importance of early detection, and to recognize the value in accessing quality healthcare. And empowerment, that's the end game. When we're empowered, we're equipped to take control of our health, to challenge systemic inequalities, and to champion proactive health behaviors. But remember, we're in this together. Your voice matters, your actions matter. Together we can amplify the call to end HIV/AIDS in Black communities. Together we can make a difference. Let's unite to end HIV/AIDS in Black communities.